Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we help families of critically ill patients in intensive care improving their lives instantly so that you can exercise power, influence decision making and stay in control of your and your critically ill loved one's destiny. Welcome to your Instant Impact video or your Instant Impact report. This is the video version of the ebook. Congratulations and thank you that you are taking the time, and more importantly that you are taking the initiative to seek out for help and to look for answers. And as I promised to you, here is your free Instant Impact report and video that will help you instantly help to take control, take power back and influence decision making if your loved one is critically ill in intensive care. It will also help you to position yourself mentally and become mentally strong. Just by doing that and seeking for help, you stand out from the rest of the families in intensive care, and it will give you an edge when dealing with the challenges, difficulties and complexities in intensive care. This free video will help you find your voice in the jungle of complexities surrounding intensive care. I know that the situation you, your family and your critically ill loved one in intensive care are in is challenging and difficult. You and your family feel fearful, vulnerable, challenged, out of your comfort zone and frustrated. So what you get in your Instant Impact report and in this free report, you will discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability. You get 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You'll get behind the scenes insight so that you understand what's really happening in intensive care. You'll further discover how to change your thinking and your behavior that might hold you and your family back to have more control, more power and more influence whilst your loved one is critically ill in intensive care. You learn how to control your emotions, how you need to manage doctors and nurses in intensive care, and it's not what you think it is. You'll further discover how to speak the secret intensive care language so that doctors and nurses know straight away that you are an insider and that you know and understand what's really happening in ICU. Furthermore, you learn how to deal with critical situations and end-of-life situations, and how to manage the rest of your family. In this video, I help you to deal with those massive challenges. Furthermore, in this free video, you will discover how you overcome your fears, your frustrations and your struggles in this challenging situation. Once you will also discover how you need to mentally position you and your family well so that you and your family are mentally strong, so that you can influence decision making, have real power and real control fast. In this free Instant Impact video, I'll give you 5 killer tips and 5 killer strategies that will immediately set you apart from the rest of the families of critically ill patients in intensive care. If you implement those strategies, and you can shift the dynamics in your relationships with doctors and nurses straight away, and I'll promise that you will feel like you have control, power and influence in this challenging situation, irrespective of what your critically ill loved one is going through, because most families of critically ill patients in intensive care do feel extremely frustrated, vulnerable, challenged and overwhelmed with the situation they are finding themselves in. The free Instant Impact video is leading you through the first steps you need to take in order to be impactful, powerful and in control whilst your loved one is critically ill in intensive care. There are many more free resources for you and for your family on our IntensiveCareHotline.com website that will tie right in with this report and that will help you going through this challenging journey. You will find links to more free resources towards the end of this video. Now, the reality is that other people are making decisions and what you need to do about it. As you have probably figured out by now, with your loved one being critically ill in intensive care, other people are making decisions for you and for your critically ill loved one in intensive care, and other people are in charge. If you have come to intensivecarehotline.com, you are probably seeking for answers, you are seeking for help, and you are seeking advice because you are out of your comfort zone. You are overwhelmed, you feel vulnerable, you are scared, and you are frustrated because your loved one is critically ill in intensive care, and other people are driving the bus, so to speak. You may or may not have the knowledge about hospitals and about intensive care, but what is really frustrating you the most is that other people are making decisions, and you may feel like the doctors and nurses in intensive care are talking over you or at you rather than with you. What frustrates you the most is that your loved one is critically ill in intensive care, and by the time you are reading this or watching this, you may still have no clear picture as yet how unwell your critically ill loved one really is and what exactly the future brings. In more than 15 years intensive care nursing experience in 3 different countries, I have seen many families of critically ill patients frustrated, vulnerable, and overwhelmed with the situation that they and their families find themselves in after their critically ill loved one has been admitted to intensive care. And I have personally guided hundreds, if not thousands, of families through this difficult and challenging situation by encouraging, by empowering, by advocating, and by guiding them to control the situation and influence decision making. There is very often no immediate help, advocacy, or guidance for families of critically ill patients in intensive care, and that's why families often feel overwhelmed, why they feel out of their comfort zone, and why they feel left alone. There is very little or no advocacy for families of critically ill patients in intensive care, period. This free video is designed to help you and your family to be more influential and help you to get quick insights in what's really happening in intensive care. And our reports, videos, and audios are designed to help you find balance during this difficult and challenging time in your life. This video is designed to give you a good understanding of what's happening in intensive care and how it impacts on you, your family, and of course how it impacts on your critically ill loved one. I know that you often rely on clues of what is said and what is not being said, and it can be hard to interpret all the noise of the verbal and the non-verbal things of the intensive care team. Therefore, you need a quick intensive care crash course so that you understand how an intensive care unit operates and functions, so that you have more power, more control, and more influence. Your thinking, your reaction, and the presence you have in this challenging and difficult situation more often than not determines your level of control, level of power, and level of influence in your family's, and in your critically ill loved one's life. You might say and think that the doctors and the nurses in intensive care are working extremely hard, and they may be doing the best for your critically ill loved one, and I'm not questioning their integrity and dedication to their work. IntensiveCareHotline.com's mission is to help you and your family with our free instant impact video and other free resources on our website, so that you know what you can and what you need to do in order to get your focus of control, focus of power, and focus of influence back. You want to be mentally well positioned and mentally strong to be able to deal effectively with whatever this challenging situation is throwing at you, at your family, and at your critically ill loved one. The intensive care team don't often make the time to explain to you and your family what's really going on, and they certainly don't want to let you look behind the scenes. So let's get into the juice of this video and start with instant impact number 1. Acknowledge your fears, your frustrations and your struggles, and then deal with them effectively. Now, the situation that you are in is not an easy one. In fact, it's a bloody difficult and challenging situation that you, your family and your critically ill loved one in intensive care are in. I have seen this situation over and over again, that families are totally out of their comfort zone, overwhelmed, challenged and frustrated when their loved one gets admitted to intensive care. And guess what? It's okay. It's okay to be frustrated, fearful and vulnerable, because you don't know what is about to happen. Most families that I see in intensive care are fearful and scared. In fact, they are usually scared to death, and more often than not, they are trying to pretend that they are not scared and that everything is okay. Nothing could be further from the truth, and obviously, when you have seen families of critically ill patients in intensive care over and over again, you get a feel for what's really going on inside of them. So strategy number 1 therefore is, it's okay to admit to yourself and to others that you are scared, that you are fearful, that you are frustrated, that you are out of your comfort zone, that you are overwhelmed, and that you might even be despaired. There's nothing wrong with having those feelings. You are only human. It's not a sign of weakness to have and feel those feelings. But it is critically important that you acknowledge and admit those fears to yourself and to others. Try not to pretend. Once you have come clear that this is how you feel, and you can show it to others as well, you are in a much better position to deal with those emotions efficiently, and you will be able to control and change those emotions. Only after you have come clear that this is the new situation that you, your family and your critically ill loved one in intensive care are dealing with, and that this situation is stirring strong emotions inside of you, only then can you start managing those emotions and also change those emotions. Turn a perceived weakness into strength. Don't try to undermine or suppress your emotions. You can feel those emotions, and you can and you even should feel those emotions fully, because feeling those emotions is a good and a healthy sign. You just can't have those emotions controlling you. Feeling those emotions will make you stronger and will make you determined, but if you let those emotions control you, you are doomed. It's true what they say, that what doesn't kill you only makes you stronger. So, acknowledge that this is how you feel and use those emotions to your advantage by changing those emotions into resolve, determination and strength. Instant impact number 2. Stop putting the intensive care team on a pedestal and do not suck up to them. Over and over again do I see families of critically ill patients showing far too much respect for doctors and for nurses in intensive care, to the point where they suck up to them. Now, there is nothing wrong with having respect for other people, but stop showing too much respect for the intensive care team, and under no circumstances do suck up to them. Families of critically ill patients in intensive care not only show too much respect for doctors and for nurses, and they most of the time suck up to them and put them on a pedestal. Stop doing that, and stop doing that right now. It's so critically important that you don't put the intensive care team on a pedestal. I see families of critically ill patients in intensive care making this big mistake over and over again, and you are handing over your power on a platter. In fact, if anything, the doctors and the nurses might lose their respect for you if you keep doing it. You might do it unconsciously, and you might be unaware of that you are doing it, but stop doing it right now and make friends instead. Most families of critically ill loved patients in intensive care are so overwhelmed by their emotions that they can't control their emotions, and therefore they are feeling weak, and that's why they consciously or unconsciously suck up to the doctors and the nurses, and by doing that they give away all of their power. So the alternative is to just start talking to them as if they are your friends. Don't see them as a doctor or as a nurse, just start seeing them as your friends. Don't think about that your critically ill loved one's life in intensive care is in their hands. Also, act with confidence, speak clearly, and be clear in what you want as well. If you do just that, if you stop sucking up to the intensive care team, if you stop putting them on a pedestal, and if you start talking to them as if they are your friends, you have gone further than most other families in intensive care already, and your level of influence, your level of control, and your level of power has increased tenfold. You can literally see the dynamics shift straight away. What goes hand in hand with families sucking up to doctors and nurses and putting them on a pedestal is that some people think, oh, he or she is a doctor, or he or she is a nurse, so they must be smart. Now, I don't care what your level of education is, but you need to stop thinking that way. Whatever level of education you have, or the doctors or the nurses have, it doesn't matter. Look at the situation differently and know that you, your family, your critically ill loved one, the doctors and the nurses are all in one boat. You are all in this together. The universe has brought you all together in this particular situation, regardless of where you, your family, your critically ill loved one, the doctors and the nurses have come from, and regardless of where you are going to. Just change your point of view. Look at it differently. Do not think about the doctors and the nurses as being smart, or think that they are any smarter than you are, and just look at them as being your friends. Always remember, there are plenty of other things and areas in life where you have tremendous expertise and knowledge about, where a doctor or a nurse wouldn't have a clue about. You might think, Patrick, but I don't know anything about intensive care, or I don't know enough about my loved one's critical illness, so I can't act confident and self-assured. Now, here's the thing. You may not know as much as the intensive care team knows about the critical illness of your loved one, but you'll be surprised by how much you can find out about your critically ill loved one's situation in a short period of time, just by asking the right questions. And you can find out quickly what questions to ask just by looking at our free resources on our intensivecarehotline.com website. You will also be surprised that by just standing out from the crowd and by standing out from other families of critically ill patients, how much more influence, power and control you can have in this challenging, difficult and frustrating situation. Once again, you will stand out by acting confident, by treating the intensive care team as your friends, and by asking questions. Don't make the mistake of not asking questions, and don't assume that the intensive care team will tell you everything you need to know. They simply won't tell you everything you need to know, because they are busy people. Furthermore, health professionals in intensive care are like fish in water, and therefore they can't always see what questions you might have that are obvious to them, because they do it day in and day out, and they live and breathe the environment. Instant impact number 3. Face reality as it is. Okay, here you are. Your loved one has just been admitted to intensive care, and after the first meeting with the intensive care team, you might get told that your critically ill loved one has been severely injured, and the intensive care team thinks that your critically ill loved one will not survive his or her ordeal. Or you might get other, less devastating news, but you still get bad news, and the intensive care team might tell you that your critically ill loved one is likely to survive their critical illness, but they might also tell you that your critically ill loved one might be permanently disabled or might not have the same quality of life than before the admission to intensive care. Whatever challenging or difficult situation you are in, face it. It's so critically important that you face the situation head on, no matter what. I know it's a tough call, and whatever the situation you don't want to face, it's so important for your own and for your family's emotional well-being and sanity. You will, of course, feel challenged, frustrated and vulnerable, and if you are in a situation where your critically ill loved one is not going to survive their ordeal in intensive care, or where your critically ill loved one's admission to intensive care has a massive negative impact on their future life, it's certainly devastating, frustrating and challenging without any doubt, period. But the sooner you come clear with what you are dealing with, the sooner you also come clear about what it is that you, your family and your critically ill loved one need, and what you need doing in this particular situation. More importantly, as soon as you face reality as it is, you will start actively looking for the right questions to ask that will point you in the right direction of what to do next. This could be as simple as asking what support is available for your loved one after discharge from intensive care and after discharge from hospital. Questioning the approach of the intensive care team in an end-of-life situation. For example, would your critically ill loved one be better off in a different room or area in the ICU where it's quieter and where they can have more privacy and dignity? You can ask for a different doctor or nurse as you feel like your critically ill loved one is not receiving the best care. Don't be afraid to do so if you are in doubt. If your critically ill loved one is in an end-of-life situation and the intensive care team suggests to withdraw treatment and you and your family don't agree, or don't agree as yet, or you want more time to think and absorb everything that is happening, you should also ask for the intensive care unit's policy about end-of-life care or about withdrawing of treatment policy. Don't be afraid of doing that. If hospitals are ethical and follow the right procedures and processes, they will not be hesitant in letting you have access to those policies. By just doing that, the power will shift immediately. It's simple, and it's your damn right, if not your responsibility, and hospitals need to be transparent. You want to get as much information as possible. You also want to have as much impact as possible. It could well be that the intensive care team is trying to pressure you to agree to withdraw treatment on your critically ill loved one, and you are still waiting for some relatives to come in from overseas or from interstate, and you don't want to let your critically ill loved one go without some key family members being around. If that's the case, you need to make that crystal clear to the intensive care team. Before I go off on a tangent here, I need to reel myself back in and come back to our initial point that you need to face reality as it is. And once you have come clear with your emotions, your overwhelm, your frustrations, your vulnerability and your fear, it's time to focus on what you can control. I have given you some hints above on what you can control. Now, 99.9% in life you can't control. If you focus on the 0.1% that you can control, and you become a master of what you can control, you are in charge of your own destiny. Instant impact number 4. Know what you want and be crystal clear about it. To know and to be crystal clear about what you and your family want in intensive care for your critically ill loved one in this challenging and difficult situation can make all the difference to the outcome. That's why it's so important for you, for your family, and for your critically ill loved one that you know what you want. It's very likely that you and your family need to make decisions for your critically ill loved one, as he or she is not in a position to make his or her own decisions. Now, you might say, Patrick, how do I know what I want if I don't even know what the next few hours might bring? And you are right. If you have come to this video and if you are looking for advice, you might not know what the next few hours have in store for you, for your family, and for your critically ill loved one. Intensive care can be a very unpredictable, challenging, and volatile environment. How do you actually deal with that? Okay, here is the thing that you need to know. This fourth instant impact strategy ties right in with instant impact strategy number 1, which was acknowledge your fears, your frustrations, and your struggles, and then deal with them. And it also ties right in with instant impact strategy number 3, face reality as it is. If you haven't watched or read those strategies, go back and watch or read them again, because they tie right in with this instant impact strategy number 4, know what you want. So, after you have acknowledged your fears, your frustrations, your struggles, and you have dealt with them, and after you have faced reality as it is, and I'm well aware that you, your family, and your critically ill loved one in intensive care might face a stark reality. You need to think clearly about what the best outcome in this particular situation looks like for you, for your family, and for your critically ill loved one. You also need to be specific about the outcomes that you want. Very few people are specific about the outcomes they want, and they keep it too general. After you have done the reality check, you need to get an understanding and a clear picture of what your critically ill loved one in intensive care might be in for. And you need to get an understanding of what your critically ill loved one's prognosis is going to be. To do that, you can get a lot of free information on our website about most clinical pictures and admission scenarios to intensive care, which will be giving you a lot of insight. Go to the Intensive Care Insights in a Nutshell section and find your loved one's condition or admission scenario there, or look in the same section for your loved one's treatment in intensive care. You also need to listen carefully to the doctors and the nurses, and you need to ask the right question or the right questions. This website and our free reports and free videos are giving you a lot of insight of what questions to ask. You need to listen carefully, though, of what is being said and what is not being said. Read between the lines. Also, keep in mind that the medical staff in particular might have a more negative outlook compared to what is really possible and what is really happening for a number of reasons. I'm shedding more light on those reasons in my bonus report about 10 things doctors and nurses are talking about if your loved one is critically ill in intensive care when you are not present at the bedside. Also, know that when I say that you need to know what you want and you need to be specific about it, you need to adapt the what you want to your and your critically ill loved one's particular situation in intensive care. I'll give you an example so that you understand what I mean. I'm going to run you through some scenarios and examples so you know what to do. Let's say your critically ill loved one has just been admitted to intensive care after a car accident, and your loved one sustained severe head injuries, sustained massive rib fractures, a broken pelvis or a broken hip, and a fractured shin bone. Your loved one is 45 years of age, and you and the rest of your family are absolutely shocked and devastated. The intensive care team has told you that your loved one is extremely unstable, not only because of their severe head injuries, but also because of the rib fractures that cause difficulties ventilating your critically ill loved one, and the fractured ribs also put pressure on your critically ill loved one's heart, so that their heart went into an irregular heart rhythm. Your critically ill loved one has also lost a fair amount of blood due to severe bleeding from the pelvis. The blood has been replaced by giving blood transfusions. Despite the fractured pelvis and the fractured shin bone, your critically ill loved one has not had the pelvis or the shin bone surgically repaired as yet, as your loved one is too unstable to go to theatre for surgery. The intensive care team is working extremely hard to save your critically ill loved one's life, but the scenario that I'm explaining is an extremely difficult and challenging scenario, not only from a clinical point of view, but also from your and your family's point of view, because you don't know what is about to come. It would also be difficult for the intensive care team to exactly predict the future for your critically ill loved one. In order for you to understand and also know what you want in this situation requires an understanding of what might happen in the particular situation that you, your family, and your critically ill loved one are in. In our example, 5 things may happen. Number 1. Your critically ill loved one is going through a long and burdensome stay in intensive care and is going to fully recover. This usually takes time and may require rehabilitation after the hospital stay. The next scenario, number 2, that might happen is your critically ill loved one is going through a long and burdensome stay in intensive care and will be left with some impairments, or he or she may be left with a permanent disability. This will take time and may require some out-of-hospital rehabilitation as well. The intensive care team also thinks that a good quality of life is possible despite the impairment or disability. The third scenario that could happen is your critically ill loved one may go through a long and burdensome stay in intensive care and may not recover and pass away within a foreseeable time frame, usually a few days or within the next week. The fourth scenario that could happen is your critically ill loved one may become so unwell and unstable because of the severe nature of their injuries that they are rapidly approaching their end of life, and their life may be slipping through the fingers of everyone quickly, and they may pass away relatively quickly within few hours or a couple of days. And the fifth scenario that could happen in this situation is your critically ill loved one may show signs of slow recovery and stability, and the intensive care team thinks that if your critically ill loved one would survive their ordeal in intensive care, they would be permanently disabled, with the consequences that your critically ill loved one would have no quality of life. This would very likely be a cause of the severe head injuries, and the intensive care team expects your critically ill loved one to be permanently and severely disabled with no or very little quality of life. Therefore, they suggest a withdrawal of treatment might be in the best interest of your critically ill loved one to not prolong your loved one's suffering. I have tried to condense this example, and I know that these are grim scenarios in the example that I have used. But if you have watched this far, you are probably in a situation where you are looking for answers. I hope that your family's and your critically ill loved one's situation is much better than my example, but you can certainly adapt my example to your and your critically ill loved one's unique situation and learn the right lessons from it. Your and your family's job in your particular situation is to find out what the future has in store for you, what the future has in store for your critically ill loved one, and then get very clear of how you would like that to look in your situation. Now, this is the end of video 1, and please continue watching the second part of the instant impact video in the video just below.